Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. This month, as you're aware, we are presenting a whole series on Facebook on medical emergencies and how to tackle them. While it is stressful enough when adults fall ill, it is a source of extreme anxiety when a baby is ill or injured. Emergencies in infants and children can involve a lot of things. It can be caused by accidents or falls, burns, drowning, electric shocks, or poisoning. And it can cause very alarming symptoms like unconsciousness, fainting, or choking, or convulsions, breathlessness, or blue lips, vomiting blood, or increasing pain, and even neck stiffness or bleeding that will not stop, head injuries, burns. So there are so many childhood or infant emergencies that can happen, and they can be indications where you need to be very watchful and call an ambulance and take your baby to the emergency at the earliest. So it's very important to recognize these situations, prevent them also, and if these situations arise, to take timely action. So let's discuss today the common pediatric or emergencies in babies and find out exactly what we need to do. And to discuss this topic, I am very happy to welcome Dr. Omprakash Jamadar, who works as a consultant in Pediatrics and Neonatology at Apollo Hospitals, Navi, Mumbai. Dr. Omprakash Jamadar did his initial medical training at Seth GS Medical College and KEM Hospital, Mumbai. Since he had keen interest in the field of neonatology after finishing his MD Pediatrics, his teachers guided him for further training abroad, and he was selected for the 2-year neonatology fellowship program in the UK, had been awarded the MRCP-CH and DCH. He's a national faculty in Basic and Advanced Neonatal Resuscitation Program, NRP, National Faculty for Neonatal Emergency Simulation Training as well. Has been invited as a faculty in many conferences, and his special area of interest is improving the quality of newborn care in the developing world. Welcome, Dr. Omprakash Jamadar, to this session. Thank you so much for joining us, and I'm sure our viewers are eagerly awaiting your guidance on this very, very important topic that everybody should really be very aware about. So let's begin by asking you, what are the most common emergencies that can happen in infants that parents must be aware of? And if you like, we can divide this whole conversation into newborns and infants and then into slightly older children.
So first of all, I must appreciate our team that they are discussing the medical emergencies, not only in the adults, but also in the children. And as Dr. Srinidhi very specifically mentioned, the adult emergencies are slightly different than the pediatric emergencies, and parents tend to become very panicked when they face the emergency situation. So let's try to understand what is in an emergency first of all. An emergency is a situation, it may be a severe injury or a severe illness that can cause life-threatening effect to the child, which may be an immediate effect or it may be a long-lasting effect to the child. Now, these emergencies in newborn babies or infants, that is children less than 1 year, are slightly different. And those who are more than 1 year to 15, 16 years, they are slightly different. So we are going to divide the topic into emergencies in infants and emergencies in the children. That is one aspect. Second, emergencies caused by accidental injuries and emergencies caused by underlying medical illness. As Madam has already elaborated the list of things that we commonly see, it may be a simple injury like while, child on a bicycle just falls down on the road and gets a head injury, or it may be a severe injury like went to a swimming pool and has got a severe drowning effect, or it may be because of underlying conditions like asthma getting exacerbated or underlying heart disease leading to a heart failure. So these are different sets of emergencies that we are going to talk a bit about. So in children and in neonates, if I try to divide them, so to start with, in the newborn, the emergencies that we face is in relation to the infection. I will say neonatal sepsis is the commonest cause of morbidity and mortality in Indian scenario. And that's the reason we need to be very careful. Any baby who is less than 6 months old having episodes of fever, is not feeding well, baby is very sleepy and tired, or has got repeated episodes of vomiting or loose motions, we need to be very careful in these babies. And we do see some accidental injuries also in these babies, like babies on the bed and then suddenly baby falls down from the bed, or mother is preparing something and there is a hot water bottle or hot milk is there beside the baby, and then baby just rolls around that and then gets burns from that. So these are the accidental injuries that we do see. And if you go to the bigger baby slightly, maybe, so falls is commonest, as I said, maybe from the bicycle, maybe from the bed, or is just child is walking around playing with other kids, and then other kid just trip over the child and gets fall, causing the injury to the head, which may be visible, which may not be visible, like things which may not be visible, like if there's an injury to the brain, externally we may not notice it, but child will be having some signs symptoms that we will be discussing. If there is injury to the chest or abdomen, again externally we may not see the major injury, but internally there may be some difficulties like bleeding and causing shock and all that problems. The second is burns are also not very unusual for them. As I said, if they are playing around with some matchstick or some other equipments in the vicinity, that can cause burns to them. Electrocution is another important factor, because nowadays our sockets are, low-lying sockets are there. So, and if they are not very well protected, they are not child safe, then, while playing, kids can just insert their finger or insert some metallic objects inside that and can come with electrocution, which is very difficult to manage. Nowadays, bites in terms of the snake bites or scorpion bites are not so much seen in urban situation, but still in rural population, we do see significant number of bites causing all these problems. And then going further, allergies are well-known entities to cause acute emergency situation. Like we have seen children coming with sudden onset of swelling all over the body. There is rashes all over the body. Sometimes they do come with breathing difficulties. So these are some accidental injuries that we see in babies and children. And because of the underlying illnesses, like if someone has got a history of fits or convulsions, what we say, suddenly they start throwing convulsion, and convulsions are lasting for a long time, and that can cause long-term damage to the brain in terms of low oxygen, and we call it as a hypoxic damage to the brain. Or if someone is having asthma, then asthma gets exacerbated, and then they come with a breathing difficulty and respiratory failure. And it's not just the acute part, but a condition which is a chronic condition like diabetes. If the sugars are not well controlled, or parents miss the injections because of some underlying illness to the child, these kids also can come with a condition called as a diabetic ketoacidosis, where the sugars are very high and they have got a severe dehydration and breathing difficulties. So these are the common emergencies that we see in our day-to-day emergency practices, and we will try to cover as much as possible out of it, and we'll try to make it in a way that it will help you in your daily practices. That is our aim of today's discussion.
Definitely. So maybe we could just go on to discuss some of these, each one of these most important emergencies. So I would leave it to you, over to you, Doctor.
So again, going in the sequence, like, newborn babies, as I said, infections are the commonest cause of emergencies for them. So babies' infections are commonly happening because of the lack of awareness of the parents about the hygiene. So with COVID in place, I'm sure most of us are taking care of the hand hygiene, using sanitization for all of us, as a routine that we are doing. But particularly when babies are preterm babies, when they are small in size, these are the babies who are at a higher risk of developing infections. So in that situation, I will suggest we should not have got overcrowding surrounding the baby. Not many people should handle these babies. Feeding is the second important parameter that help us to decide whether baby is healthy or not. Any baby who is not feeding well is unusually sleepy than what we see on day-to-day basis. That means there is some difficulties there. And when the feeding is not happening well, their sugar tend to get low. And as a result of that, they become more sleepy. We have seen babies with low sugars presenting with convulsions or fits in the newborn babies also. Now, in this situation, I will say you should not waste time in your home surrounding, because this is an emergency which needs to be managed in the hospital vicinity. Some babies, because of the infection, can present with cold clammy extremities. They turn blue at the hands and legs. That is also another situation where we should take help of the emergency services. Sometimes babies do omit, once a while, maybe 2 to 3 times in a day they do omit. But if baby is getting repeated episodes of vomiting, maybe after every feed, particularly big amount of vomiting, or there are blood in the vomiting, or if there is a greenish color vomiting, that means there is some medical issue, there is some underlying surgical issue for the babies. So these babies need an urgent attention. There is something called as a hemorrhagic disease of newborn. I'm sure many of you parents must have seen immediately after birth, we do give some injection to the baby. So that is an vitamin K injection that helps to decreases the chances of bleeding in these newborn babies. So if baby is having some bleeding from the vomiting or there is some bleeding from the motion, that means there is some difficulty that baby is having and needs an urgent attention in that situations. Now going forward in the infancy, like babies who are less than 1 year old, as I said, the falls are very common for them. I always say to the parents, Nazar hati, durgatna ghati. So that means the moment you have lack of attention towards the child just trips over and then falls from the bed. So I always insist on home safety for the children. So what does that mean? So we need to have an environment where the chances of accidents we are trying to minimize, but believe me, it won't be 0%. You can't make it like totally child proof. So what we can do, we can have a beddings or mattresses on the floor. The sofa set may not be too high, it can be a low lying kind of sofa set. So by chance, if the child trips from there, there are chances of injuries which will be less for the child. Many times while playing or walking, they still sleep on the floor, which is a hard floor. So that hard floor will cause more injury to the child. So if you put thick mattresses on the floor, that will help a lot for them to prevent severe injuries. And similarly, the corners of all these wooden furniture that we have got, we can cover these corner areas. We do get some soft materials in the market nowadays which can cover the corners. So that will help to decrease the injuries by these corners. And next, electrocution part, make sure your height of the electric sockets are slightly higher than what we have seen in most of the homes nowadays. And there is a protective cover to these sockets so that child can't easily insert their fingers or some toys inside and then get electrocution burns. Next is burns. We do suggest steam inhalation many times to the parents when they have got a cough, cold, or fever. So we have seen babies coming with burns because the steamer is just beside baby, and while playing, baby just put their fingers or holds the steamer in their hand. So we need to be careful when we are keeping hot equipments or hot water or food which is hot, like maybe tea and coffee burns are also not very unusual that we see in small kids. So these are the things that we need to be careful with the infants and newborn babies. So we need to have special precautions for them, and then we should try to pick them it early.
So what are the very important signs where we already spoke about drowsiness and about the continuous vomiting, diarrhea, blood in the vomit. So, like if you would list, the emergency, the signs where they have to immediately rush to the emergency, it'll be helpful to the parents.
So we call it as a red flags.
Yeah,
This is the
exactly.
situation where we need to get in touch with your health services. So again, injuries and medical illnesses that will help us to. So falls which are significant. So how do you say a fall is significant? Like a child which fell down from a 5 feet, but externally child looks fine, but there is associated bleeding from the nose, bleeding from the ear, or there is a fracture involving any extremities or a depressed fracture in the head. That means there is a significant fall is there. Okay. So what happens to this child? They tend to be unconscious. They may be more sleepy than usual. They may have got episodes of vomiting. So these episodes of vomiting are because of the increasing pressure in their head. The intracranial pressure increases. So this is one part. Second, if there is a fall on the chest or abdomen, externally it looks fine. There is just a bit of bruising that we can see, but suddenly the child start appearing very pale and become cold and clammy. That means there is an internal injury. So these are visible and non-visible effects of fall that we can see. If you go to the next common injuries that we see is burns. Now, any burn which is involving more than palm size of the area of the child, like if you see the palm of the child and just compare the area of burn, if that area of burn is more than size of the palm, that means it is a significant burn. Second, burns which are on the face involving eyes, or there is no direct burn to the child, but child was in a close vicinity where there was burn, and child has taken the so much of carbon monoxide, carbon dioxide that is coming out of the flames, and the child is drowsy out of that. So this is the effect of the burns, which may be direct or indirect effect, and in that situation you need to get in touch with your health services. Next, if there are any bites, or it may be a scorpion bite, or maybe a snake bite, or it may be some bee sting which is contributing for local swelling, redness. We have seen some babies coming with snake bite and they are totally kind of paralyzed situation. We call them like a neurotoxic snake bites. So this is another situation where we need to get in with the emergency services. In allergic reaction also, we do get babies with swelling all over body, itching sensation, breathing difficulties. So we need to connect with your emergency services. So these are all injuries where you need to get in touch with your emergency services. Now going forward to the underlying illnesses causing problem, like a child who is on treatment for asthma and then suddenly start getting breathless. So that means the child is not able to breathe comfortably. If you ask the name of the child or if you ask anything, he won't be able to complete sentences. Like, like he will say one word, he'll take breath. He will say another word, take breath. So that means the difficulty is severe. This is how you identify the problem is a critical problem, and then you can take help. And as I told you earlier, like we have seen diabetic ketoacidosis where the sugars are not, the insulin is not taken on regular basis. So sugars becomes uncontrolled and these babies tend to get with dehydration and then acidosis causing fast breathing. If someone who is having history of convulsions, fits what we say in normal words. So first of all, let's try to understand whether it's a normal jerky movement or whether it is fits. Like, if someone is shaking the hands, if you hold their hands, it stops. That means it's a normal jerk. But someone who is shaking their hands and legs, they're uprolling their eyes, and if you try to hold, the movements are not getting stopped, that means it's a fit or it's a convulsion. So in that situation, nowadays, for someone who is having history of fits, we do give home remedies. We give them the midazolam spray. You must have heard of this medicine, midazolam, that is for convulsions, that is for fits that we use in hospital services. But with advances of the facilities, we have got sprays. You must have seen nasal drop that we put whenever there's a blocked nose. So similar sort of sprays are there that we can put in the nose of nostrils of the baby. So that helps to control the convulsions. So these are what we need to look at the sign symptoms and then get help of our emergency medical services.
So what happens if there is, like a bite or a sting or like any wound like that, a bite injury in a baby or an infant? What needs to be done?
So bites again will come to our vicinity, immediate vicinity. What are the bites we can get? We have seen some kids with dog bites, bad bite, pulling out all the muscles there. So that is one situation where I will suggest don't cover that area with too much of, because there is a contaminated wound is there. So you need to clean the wound under a free flowing water. Okay. And you can stop bleeding by local compression, but till the time bleeding is there only that time. Once bleeding is stopped, don't, too much cover that area, particularly in relation to the dog bites I'm talking about. But other bites or other injuries, we can cover the area once that area is cleaned. Okay. Now, stings and bites, one is local reaction and one is the systemic effect on the body. So snake bites, some bites can cause bleeding at the site as well as bleeding all over different parts of the body. We call it as a vascular toxic snake, and some snake bite may not cause much of local reaction, but they cause weakness of all the muscles in the body. We call it as a neuroparalytic. So in both situations, the child needs help. So after initial stabilization, your surrounding, you shift the child to the emergency services. Second, some bites causing allergic reaction, where you can get a local bite followed by swelling all over the body, and that swelling, which is visible to us externally, have got an effect on the breathing pipe. So just to remind you all, the breathing pipe of the babies is very small, and a little bit of swelling is enough to cause obstruction for the breathing. So immediately we have to rush to the hospital in case of allergy causing breathing difficulty. If there is a known situation of allergy, like we have seen some kids having allergy to certain nuts or certain food products, these parents we advise to keep a medicine called as a adrenaline pain. uh, I have seen it outside, but in India, it's not still easily available. So we ask these parents to how to prepare it and keep the injection available in their home. So that can be given by the parents, and the severe allergic reaction can be terminated immediately. So these are the bites and stings contributing for the local immediate reaction and systemic reaction we should be aware of.
What about drowning when the children fall into the water?
Yes. Most of the societies nowadays, you have a small pool or a big pool. So again, parents need to be very vigilant whenever the child is around the pool areas. Okay, that is one part. Now, by mistake, if the child goes underwater, body has got a good capacity that they come out of floating before they drown completely. If you can see and notice that the child is in a state of drowning, you have to get the child outside immediately. Now here I'm going to tell some principles like airways, breathing and circulation. Okay. So in drowning, what happens? Water and lungs are filled with water. So your breathing circuit is packed because of foreign body like a water. So we need to clear the airways. So we use electronic suction machines. You can have something like a simple as a mucus extractor or something to clear up the airways. But in that emergency situation, if you don't have the facilities, what you can do, I've tried to get one baby to just demonstrate. So just get them to one side. If you can see water coming out, well and good. If not, you can give them a bit of prone position to clear up the secretions. Okay. Then second stage, what is happened, like the water has gone inside, we have tried to clear it externally, so we have tried to clear up the airways. The child, by this time, by clearing of the water, look whether the child is breathing or not breathing. In babies, it's primary respiratory failure followed by cardiac failure. In bigger children and adults, it's primarily cardiac failure followed by respiratory failure. So here, once you have tried to clear up the secretions, see whether baby is breathing or not. If the baby is not breathing, we may have to go ahead with your mouth to mouth breathing, because I don't expect equipments available in that scenario. But I will also suggest at the same time that around the pool areas, make sure there are some emergency services, emergency facilities in terms of maybe just a suction equipments or bag and mask is available, and some trained person is there in the vicinity wherever there are high risk areas of like pool. So you have cleared the airways, you want to go for breathing, so you can go for mouth to mouth breathing. Okay. So now like it's your own child or your maybe neighbor's child. Still, you need to be taking care of your own risk of infections, because we never know what infections can come from one person to other person. So you can use your hand as a barrier. You take air and then blow the air in the mouth of the child and nose of the child so that the chest starts rising. So we are trying to do an external breathing efforts, and this will happen once the airways are clean. That is one. And still, if you are doing that, but still child is not getting up, that means we may have to take help of doing cardiac compressions. So if you are a single alone person trying to manage the emergencies, we suggest 2-finger technique to compress the chest. Like we do 1 and 2 and 3 and then breathe. If it is a bigger child, infant, we try to do compressions 15 times and then we do give 2 breaths. So this is how we will try to do the immediate resuscitation, and you should have got an emergency service activation system in place. So, like in Apollo, I must say that our emergency services 1066 is all the time available. And fortunately, in government system also 108 they have started, which is quite helpful to get activated. And these people will come at the site and then help out the baby to manage the situation. Now, if you see the event of drowning, it's very panic. So I always say when I teach to our resident doctors also, because we as a doctors also go through a lot of stress whenever we see an emergency situation. So calm down, but at the same time, act fast. These 2 principles are very important. See, until and unless you yourself are calm, you won't be able to help someone else, isn't it? So try to calm down and think what you can do best for the child. So in case of drowning, we know things are surroundings are safe once the child is out of water. But there may be situations where the surrounding is not safe, like if there is a burn is there, or if there is electrocution is there, or accidents are there, and we don't know in the surrounding what is there. There may be sudden, explosion of something or something like that. So in that situation, make sure the child and you are at a safe location before you initiate all this procedure of CPR.
What about the electric shocks if they have a electrocution?
So electric shock, there are again different severities of the electric shock are there. So if it is a mild shock in that situation, then it doesn't cause much of difficulties. But any child with electric shock, we need to get in touch with your emergency services. And if it is quite significant, it can cause your body fluid differences, causing electrolyte imbalances. It can have different changes in the rhythm of the heart, or arrhythmias, what we say. So whenever if your child has got an electric shock in that situation, get in touch of the medical services in the vicinity so that they can find out whether it's just a minor one or it is significant, causing electrolyte imbalances and the rhythm disturbances of the heart.
Finally, what about we already discussed? What about burns and scalds? You were talking about how children can get accidentally burnt or scalded. So in that situation, also, like, what should be the immediate thing to do?
So as far as burns are concerned, I already discussed about taking precautionary measures. So
Yeah.
burns which are more than size of the palms, burns involving the face and the eyes area or the private part areas are the significant burns. That is one criteria. Second, burns which are superficial and deep burns, that when we see the child, we decide how is the extent of the burns. So if burns are significant, we need to come to the emergency services. We need to clean the area. If they are minor burns, we apply silver sulfadiazine to that area to prevent the secondary bacterial infections. Now, see, our skin is a barrier that prevents entry of bacteria in our body. Whenever there are burns, that barrier is gone away. So these babies are at a higher risk of developing infections. If it is a relatively minor burn, superficial burn, we apply topical creams, antibiotic creams, as well as we do give some oral antibiotics also. However, if the burns severity is significant, they do need special dressing in the hospital setting. They need a very close monitoring of loss of water, and then we have to give some extra fluids, IV fluids for certain salts to prevent the dehydration part. And then these burns also need IV antibiotics. You must have seen, many people having deep scar secondary to burns. Now, with advances in the plastic surgeries, there are different, coverings on the burns that can help to minimize the scarring in future. So it is very important that any burns which you feel are significant, as I described, or deep burns, get in touch in time so that we can prevent this long-term complication. And that is what, I started with medical emergencies having immediate effect and long-term effects. So these long-term complications can be also taken care of if you intervene them at the right time. I would like to mention one more component of accidental injuries is choking. We have seen kids while playing, they just put something inside the mouth and then they suddenly start choking, and as a parents, we become very panic, like what can be done now? So again, try to be calm and see how is the child responding to this choking while eating. Also, sometimes in a hurry, child eats something, maybe a groundnut or peanut, and then just, it goes inside and then start coughing and then start choking. If the child is coughing, just beside with them and let them help to cough out. So cough basically tries to bring out whatever the foreign particle has gone inside the breathing pipe. Okay, that is one. Now, if the child is not able to cough out, like if it is a small infant, it was just like a few months old, that child's capacity to cough out is not much. So in that situation, we do certain maneuvers, like if you hold the child with mouth open and you try to pat at the back. So you five pats on the back at the upper center of the back. This will help to give extra pressure on the chest, and the child can bring out the foreign body or whatever has gone inside the breathing pipe. That is one. After these 5 pats, if still the particle has not came out, we can use chest thrust. So in infant small children, as I showed you the chest compression, in the similar pattern, if you give the chest thrust, you can see this cuffing effect that can happen. So this also will help to bring out the aspiration, whatever the foreign body has done. However, in a big children, it is not possible to, make them up and down like this. So we do something called as a Heimlich maneuver, where I'm going to show you how to make a fist. So you make a fist of your right hand, and the knuckles are turned inside, and the other side you try to hold it like this, so that knuckles are towards the child. You go on the back side of the child. You position the child in front of you, and just in the lower part of the chest or upper part of the stomach, you put your knuckle in an inverted manner, and then you try to push them inside. So this is if child is not cuffing. If the child is cuffing, then you just hold them and make them comfortable and say that, cuff out kind of thing. But if they are tired, they are not able to do it, they are getting unconscious, in that situation, you can do this maneuver. This is called as Heimlich maneuver. Okay. This will help to bring out the foreign particle outside. But never ever try to put your finger and then blindly try to, whatever is inside, don't try to do that. This may push things inside, and it will be more difficult for the child as well as later in the medical services to help you quickly. They will help it out by doing scopy and all that thing, but that will be more dangerous. So don't do blind sweep. You try to visualize things and then only you do it.
So doctor, when you said that the fist should be turned this way, so it should be like this, or
that's right. Yeah. So that the knuckles are in your upper part of the stomach, so that you can give adequate pressure.
So thank you, doctor, for addressing so many of childhood and infant emergencies in a very concise and very clear way. Yes, I'm sure in all emergencies, it's also a very wonderful thing that you said, that it's important to not only recognize the signs that you need to take medical help and do what is needed before the emergency help arrives or you go to the hospital, but also to do it in a calm manner so that you take the right decisions and seek the right care and do the right thing for your child. And do remember always that you must also keep your primary pediatrician also informed. And always it is true that early recognition and treatment of symptoms is very important to make sure that the illness or injury is not getting worse and becoming a catastrophic crisis. So do write in to us for any further queries, and we are available always on all the digital channels to assist you. And do remember that our 1006 emergency helpline is always available to help you through any emergency. Take care, be safe, and thank you.
Thank you. Thank you.